Hello, this is Dr. Gay from First Second MRI, and this is a 58-year-old male who complains of pain in his forefoot, the ball of the foot. There's a marker here showing where he's hurting, and deep to the marker he has an abnormal finding right here. The subcutaneous fat is bright, and there's an area where the subcutaneous fat is replaced by this intermediate signal, and this is what we call a Morton's neuroma. I'll put up another view here, coronal view. So this is right in this region here between the second and third metatarsal heads. Morton's neuromas are usually between the third and fourth metatarsal heads here, but they can also be here or anywhere. And what it is an inflammatory response to abnormal pressure on a nerve, the interdigital nerve that comes through here to go to the toes. If patients wear high heels and they have abnormal pressure on the nerve, then the body will form an inflammatory response and make a mound of scar tissue and inflammation to protect that nerve. We call that a Morton's neuroma or a perineural fibroma. So the nerve itself is not expanded, it's just there's an inflammatory response surrounding the nerve, so we call it perineural inflammation or Morton's neuroma. And there's this patient. Again, normally it's over here. On this view we see the fat coming in, right here clean. Here we see the Morton's neuroma in this region right there. It's more intermediate in signal. And here we see the fat coming in nice and sharp. So that's where it is. And here we go. Now this is another view that shows the same thing, but it's a different sequence. It has fat suppression. And we see the Morton's neuroma right there. This dark area looks just as dark as one of the tendons. This is because it has no fluid. It's just a fibrous tissue or inflammatory response, dense scar tissue without significant fluid, so it looks really low in signal on this view. So a good example of a Morton's neuroma or perineural fibroma, an inflammatory response around this nerve. Thank you very much.